Is the world facing the spread of another virus after COVID? The memories of the COVID-19 pandemic haven't even faded yet, and now an alert has been issued for another virus. During COVID, we saw body temperature checks at airports, mandatory masks, health forms, and extra screening during travel. A similar atmosphere seems to be returning once again, but this time, the reason is the Nipah virus. Yes, because of Nipah, around 100 people have already been quarantined in West Bengal, India. So what exactly is the Nipah virus? How does it spread? What are its symptoms? Who is at higher risk? And what precautions are necessary to stay safe? We'll explain all of that in this video. I'm Linda, and you're watching Banana Republic. According to experts, Nipah virus is a zoonotic disease. That means it usually spreads from animals to humans. In most cases, the main sources are cow dung bats and pigs. However, in some situations, the virus can also spread from one person to another, as seen in recent cases. Infection can also spread through contaminated food. When it comes to symptoms, Nipah infection doesn't look the same in everyone. Some people show no symptoms at all despite being infected. In other cases, the disease can cause severe breathing problems and later develop into serious brain-related illness. According to the World Health Organization and other health agencies, the disease progresses in 2 stages. The first stage is the early symptoms stage. This usually includes mild breathing difficulty, fever, body aches, severe headache, constant drowsiness, and cough. The virus mainly affects the lungs and the brain. The second stage is the severe stage, where the brain is affected. In serious cases, the patient can go into a coma and death can also occur. Infectious disease expert Dr. Deep Narayan Mukherjee said that if a patient shows any of these symptoms, even if they seem mild or unusual, they should never be ignored. Every patient is treated as a respiratory illness case. The first step is immediate isolation in a separate room. Strict infection control practices are followed. Doctors and staff wear personal protective equipment, including N95 masks, gloves, and gowns. The mortality rate of the Nipah virus is believed to be over 40%, which makes it extremely serious. This means that roughly 1 out of every 4 infected people, or even more, may lose their life. Across several Asian airports, COVID-style health checks have started again. The reason is confirmed Nipah cases in West Bengal, which have raised serious concerns in health departments. Recently, Nipah virus was detected in a hospital in West Bengal, after which around 100 people were quarantined. This included 1 doctor, 1 nurse, and another hospital staff member who tested positive. Earlier, 2 healthcare workers in the same district had also been confirmed infected. After Nipah cases emerged in West Bengal, many Asian countries went on alert and started taking extra precautions. Countries like Thailand, Nepal, and Taiwan have begun passenger screening at their airports, especially focusing on travelers coming from affected regions of India. Official Thai government sources say that Thailand's 3 major international airports have implemented health screening for passengers arriving from West Bengal. After arriving in Thailand, travelers will undergo temperature screening and must submit health declaration forms. Dedicated screening counters have been set up at airports for this purpose. Because this new virus is spreading rapidly in India, many countries around the world are starting to ban Indian products and are advising their citizens to avoid using or buying goods from India. Thailand's Parks and Wildlife Department has also started extra health screening at natural tourist spots. Overall, Thai authorities are not taking any risks and are monitoring the situation at every level to control the Nipah virus at an early stage. Nepal has also started screening passengers at its airports, especially in Kathmandu and at land border points with India. The screening process is similar to COVID-style health monitoring. Authorities are focused on stopping the virus before it spreads, which is why airport vigilance is increasing. Officials have stated that screening rules will be updated as the situation evolves. Health experts say the Nipah virus cannot be taken lightly because its incubation period is quite long. This means symptoms may not appear for many days after infection, but during that time, the virus can still spread. Experts clearly say there is no need to panic, but staying alert is extremely important. Authorities are constantly monitoring the situation to handle any health emergency in time. Meanwhile, former West Bengal health advisor and infectious disease expert Dr. Sayan Chakrabarty issued an important clarification. Speaking to ANI, you said that currently there are only 2 confirmed cases in West Bengal. Reports claiming 5 cases are not accurate. The suspected patients admitted to hospitals tested negative and have been discharged. According to Dr. Chakrabarty, it initially appeared that cases might increase, but the situation is now stable. He said the government has carried out proper contact tracing, quarantine, and testing, which has kept the outbreak under control. The earlier panic has largely subsided, and people are following health authority guidelines. The fatality rate of Nipah is considered very high, which is why experts emphasize continuous monitoring, strict contact tracing, and timely action. For infected patients, supportive care is currently the most important treatment. Experts say Nipah's fatality rate is much higher than COVID-19. Explaining disease progression, Dr. Chakrabarty says patients first develop severe headache, body pain, throat pain, and cough. The cough can gradually turn into pneumonia, leading to breathing difficulty. Then the infection reaches the brain and the patient's condition becomes critical. Currently, there is no vaccine available for Nipah virus. If infection is confirmed, monoclonal antibodies are given as early as possible to control the disease. However, the global supply of these antibodies is very low. Until then, the situation can only be controlled through supportive care, continuous surveillance, and strict contact tracing. For the general public, the advice is simple. Don't panic, but stay cautious. If symptoms like fever, cough, or weakness appear, contact a doctor immediately. Maintain hand hygiene, avoid eating open or partially cut fruits. Stay away from sick animals. Trust official health guidelines instead of rumors. Early detection, hospital infection control, and following proper guidelines are the most effective ways to stop this virus. Take care of yourself and follow necessary precautions. If you have any questions or want to share your thoughts, leave a comment below. Thanks for watching Banana Republic.